Hello friends, welcome to my channel, and in this session we are going to discuss about the anatomy of the pancreas. So in the last video we have discussed about the duodenum in detail. So let us try and learn about the anatomy of the pancreas under following headings. First we will see introduction, then location and shape, then the measurements along with the peritoneal relations, then different presenting parts of the pancreas and their relations, blood supply, nerve supply, and lymphatic drainage, and lastly, histology with development. So these contents remain same for the all of the abdominal organs with slight changes. So let us see what do you mean by pancreas. So it is a soft, lobulated, elongated mixed gland, means it is both endocrine and exocrine. This is what you are seeing here. Pancreas is a soft lobulated gland. It has both exocrine part and endocrine part. Exocrine part secretes the pancreatic juice with enzymes, whereas endocrine part secretes the hormones. Pancreas means all flesh. It is like a flesh because it is soft and lobulated, and it is located more or less horizontally in the posterior abdominal wall, in the posterior part of the epigastric and left hypochondriac region. It is a retroperitoneal organ. Most of it is retroperitoneal except the tail, and it lies across the posterior abdominal wall and extends obliquely from the concavity of the duodenum to the hilum of the spleen. It is directed upwards, backwards, and towards left, and it extends from T12 to L3. You can notice here. So the greater part of the pancreas is retroperitoneal except the tail. It lies within the lino renal ligament because it is related to the hilum of the spleen. So location we have seen here, it is located in the posterior part of the epigastrium and the left hypochondriac region. So the pain of acute pancreatitis will radiate in the epigastrium and radiate to the back. Actually, when you see here, it lies between the C-shaped loop of the duodenum and extends to the hilum of the spleen, directed upwards, backwards, and towards left. And when you see the size and shape, the shape is J-shaped or retard-shaped flask, which is set obliquely. The bowl of the retard represents the head there, and stem is represented by the neck, body, and tail. So average length of the pancreas is 12 to 15 centimeters, width is 3 to 4 centimeters, and 1.5 to 2 centimeter in thickness, and weighs around 80 to 90 grams. So it is a soft fleshy mass. Entire mass is fleshy. That's why it's called as pancreas, and it has four parts from right to left obliquely: head, neck, body, and tail. Head is that part which is located in the C-shaped loop of the duodenum. Neck lies in front of the formation of the portal vein. Body lies in front of the abdominal aorta and kidney. Tail lies within the linorenal ligament, and you can see the peritoneal relation there. So upper part of the head is non-peritoneal, where it is directly related to transverse colon, whereas the lower part of the head is related to the peritoneum of the greater sac. And you can see the body there. Upper part of the body is related to the peritoneum of the lesser sac, whereas the lower surface or anterior-inferior surface, what we say, it is related to the peritoneum of the greater sac. And here along the entire anterior border of the prismoid body is attached to the root of transverse mesocolon, and tail lies in the linorenal ligament related to the hilum of the spleen, and it is the only part of the pancreas which is not retroperitoneal. So entire posterior surface of the pancreas, including the head, neck, body, is retroperitoneal, means it is non-peritoneal. Only the anterior parts, here you can see the peritoneum related to the lesser sac and greater sac. So when you see the anterior abdominal wall, so it is divided into 9 regions by 2 vertical and 2 horizontal planes. So here you will notice the pancreas, like this posterior part of the epigastrium and the left hypochondrium. It extends from the duodenum to the hilum of the spleen, or you can say concavity of the duodenum to the hilum of the spleen. And when you open the intraabdominal wall, first you will see the great fold of greater omentum, which covers all the loops of this small intestine and colon. There you can see transverse colon, and you can see the pancreas is there, the structure which is highlighted in the green, and this is the pancreas. You can notice how it is soft and lobulated, and its shape depends on the surrounding organs. It doesn't have a definite shape, but we describe it as a J-shaped or retort shaped organ. So it is there, you can notice there. Yes, if you fade the other structures surrounding it, you can see it is related to the stomach anteriorly and transverse colon, and below to the coils of the intestine, and to the right side it is related to the concavity of the duodenum. In the left side is related to the hilum of the spleen, and most of the pancreas is forming the stomach bed and separated from the stomach by a lesser sac. So the structure which lies immediately behind the stomach is lesser sac. You can notice here, you can see the C-shaped duodenum will be here, and you can notice here how it is directed upwards, backwards and towards left, and neck and body are lying slightly anteriorly, head is directed posteriorly, it lies on the more posterior plane, and you can notice it is elongated, soft lobulated gland. You can notice here having the different parts. So if you notice here, this will be the head, neck, this much is the body and tail. That is what you are seeing. And when you notice in the dissected part, when you take out the intraabdominal wall and stomach, transverse mesocolon and transverse colon, you can see the C-shaped duodenal cavity here, and here you can notice the pancreas. This is a soft lobulated gland. So this much part is the head. You can notice there neck, body and tail, and here you can notice the hilum of the spleen there. So it extends between the concavity of the duodenum till the hilum of the spleen there. So it has 4 parts from right to left: head, neck, body and tail. Head also has a process called as uncinate process towards the left side. So these are the different parts you can notice in the specimen in situ relations. You can see here, and you can notice the concavity of the duodenum here, C-shaped concavity, and here is the pancreas, J-shaped soft lobulated gland or retort shaped flask like. So this is the pancreas extending upwards, backwards and towards left, that is spleen, secondary lymphoid organ or hemolymphoid organ. And already we have discussed the parts: head, neck, body and tail from right to left side. So let us see the relations of the each part of the pancreas in detail with their respective presenting parts. So head of the pancreas, it is that part of the pancreas which is lying in the concavity of the C-shaped concavity of the duodenal loop. It is an enlarged disc-shaped flat part of the pancreas, and it represents the right side of the pancreas, the right end of the pancreas, lying in front of the L2 vertebra. So head presents following features. It presents 3 borders there, that is superior, inferior and right lateral border, which are demarcated prominently. And this imaginary, you can say this is the left border, and here you can see uncinate process, and two surfaces, that is anterior surface and posterior surface, and this is the process. This process is uncinate process here, that is the uncinate process. So it presents three borders which are appreciable, two surfaces and one process, and you can notice there the head is in the concavity of the C-shaped duodenal loop, and you can notice the upper border is related to the first part, right border to the second part, and the inferior border to the third part of the duodenum. Superior border, you can see there, it is related to the first part of the duodenum and the superior pancreaticoduodenal artery, branch of gastroduodenal artery. Inferior part is related to the third part of the duodenum, which is the horizontal part, and inferior pancreaticoduodenal artery, which is a branch of superior mesenteric artery. So head is having the two arteries coming from the foregut and midgut respectively. The right lateral border, which is related to this concavity second part where the pancreatic duct opens, and you can see the anastomosis between the two arteries. Anterior surface, which is flat, it is related to the transverse colon. That's why the upper part of the anterior surface of the head is non-peritoneal. It is directly related to transverse colon, and below it is related to root of transverse mesocolon. Whereas posterior surface, as you are noticing here, it is related to the inferior vena cava and also to the common bile duct, and this side you will see the kidney, the right kidney and right renal vessels will be there. And coming to the uncinate process, which is the hook-like process from the left side of the lower part of the head of the pancreas, it is related anteriorly to the superior mesenteric vessels that you can notice here, and you can see there the head is related to the inferior vena cava, common bile duct, and also to the right crus of the diaphragm, right renal vessels. So those are the relations of the posterior surface of the head that you can notice. Anteriorly, what you see, upper part of the anterior surface of the head is related to the transverse colon, lower part to the root of the transverse colon and coils of intestine, jejunum and ileum. You can notice here, this is the posterior surface. Here you are seeing the common bile duct. Anteriorly, you can notice it is related to this transverse colon covered by the greater omentum that we say here gastrocolic ligament, and you can also notice the superior pancreaticoduodenal artery there and inferior pancreaticoduodenal artery. Here you will notice the inferior vena cava with right and left renal veins, or you can say vessels. Here you are noticing the common bile duct which will open into the second part of the duodenum by passing posterior to the head of the pancreas. And you can notice here, these are the, so remember, three borders and two surfaces and an uncinate process. And coming to the next part, the neck of the pancreas, it is a slightly constricted part of the gland. It connects the head with the body and around an inch in measurements, and it presents two surfaces and two borders that you can notice here, the upper border and lower border, anterior surface and posterior surface. You can see here, here is the neck, upper border, lower border, anterior surface and posterior surface. So anterior surface is related to the pylorus of the stomach. Posterior surface is having the formation of the portal vein. Upper border is related to the first part of the duodenum, whereas the lower border is related to the root of the transverse mesocolon. colon there. So you can notice here the neck, it is related to the formation of portal vein. Here you can see this is superior mesenteric vein and this is splenic vein. They together form the portal vein. So portal vein formation is seen in the posterior and superior part of the neck. If you try to see the relations of the neck here, you can see the anterior surface, it is related to the pylorus of the stomach there. And as you go posteriorly, here you are seeing the, yes, you can see the formation of the portal vein. You can notice here, this is the portal vein formed by superior mesenteric vein and splenic vein. They join here. In the lower part of the posterior surface of the neck, you are seeing the superior mesenteric vein. In the upper part, you are seeing the portal vein. So portal vein is formed in the posterior part and superior part of the neck. In the lower part of the posterior part of the neck, in this superior mesenteric vein is there. So superior mesenteric vein and splenic veins are the formative tributaries of the portal vein. So those are the relations. Next, coming to the body, it lies between the neck and tail. It is an elongated part of the gland, compressed part of the gland. It is compressed between the stomach, transverse colon, coils of intestine and post-abdominal wall. So it is directed upwards and left. It lies in front of the vertebral column just below the transpyloric plane. So these surrounding organs compress it and give a shape of prism on cross section, having the three borders, superior, inferior and anterior, three surfaces, anterosuperior surface, anteroinferior surface and posterior surface, which is tethered to the posterior abdominal wall. So it presents three borders, three surfaces and one process that is called as the tuber omental. Here tuber omental, just above tuber omental you will see celiac trunk. So body is anterior surface, anterosuperior and anteroinferior surface are peritoneal, posterior surface is non-peritoneal. The anteroinferior surface is related to the lesser sac. You can see the lesser sac here, anterosuperior surface, whereas anteroinferior surface is related to the peritoneum of the greater sac, whereas posterior surface of the body of the pancreas is non-peritoneal. Anterior border, it provides the attachment to the transverse mesocolon, which suspends the transverse colon. Superior border is related to the celiac artery, just about tuber omental. To the right side you will see hepatic artery and to the left side you will see tortuous splenic artery running to the left side of the tuber omental. That is a process coming from the body of the pancreas on the superior border, whereas inferior border is related to these superior mesenteric vessels and also to the coils of intestine. And when you see the anterior surface or anterosuperior surface, it is forming the stomach bed separated by the lesser sac. So it is related to the peritoneum of the lesser sac and stomach, whereas posterior surface, which is non-peritoneal, it is related to the big vessel there, abdominal aorta, superior mesenteric branch, left kidney, left superior gland, left renal vessels and splenic vein. Splenic vein lies in the posterior surface of the pancreas, where splenic artery runs along the superior border to the left of the tuber omental. You can notice here, you can see left renal vein, splenic vein, left kidney, and all these suprarenal veins are related there to the posterior surface. Anteroinferior surface, here it is related to the DJ flexure and coils of intestine and left colic flexure. So here you can again try and notice the relations of the body. Posteriorly you can see here aorta, left crest of diaphragm, left kidney, left suprarenal gland, this is left renal vein, splenic vein and suprarenal vein and inferior mesenteric vein which is joining the splenic vein. These all are related to the posterior surface. Left cusp of diaphragm, left kidney, left supranal gland, left renal vessels, abdominal aorta, and the splenic vein. Splenic vein is related to the posterior surface by the groove. And in the animation, when you see here, when you isolate the pancreas with its structures related, you can notice here, you are seeing the formation of the portal vein here, superior mesenteric vein, and here you can see the splenic vein, which is related to the posterior surface. Splenic artery runs along the superior border of the body, and you can notice here the anterosuperior surface is related to the stomach, and you can see the transverse mesocolon will be running there. So to the anterior border of the body, transverse mesocolon is there. Anterosuperior surface forms the stomach bed and separated from the stomach by lesser sac. So coming to the posterior surface, here again you can notice there splenic vein running along the posterior surface of the pancreas, and along the superior border you are seeing the splenic artery, and you can also notice the left kidney with its vessels and left ureter, that is the left renal artery coming from abdominal aorta, that is the left renal vein. Again they will divide and drain this left suprarenal gland also. So basically remember, the posterior surface of the body is related to abdominal aorta here, that is a splenic vein, left renal artery, left renal vein, left ureter, left kidney, and left cusp of diaphragm, and you can also see part of left suprarenal gland. So all left you can remember. Coming to the tail of the pancreas, the extreme left end of the pancreas, it is a narrow part, and as we have discussed earlier, it lies in the lienorenal ligament related to the hilum of the spleen, that you can notice here, and it is mobile unlike the other part of the pancreas, and it is the only peritoneal part of the retroperitoneal pancreas. It has largest number of the islets of Langerhans per unit of tissue compared to the other parts. You can see it has variations. 50% is related to the hilum, 42 to the lower part of the hilum, 8% related to the upper part of the hilum of the spleen, and you can see the pancreatic duct begins from the tail in the herringbone pattern or a fishbone pattern, we say. The main duct is formed between the communication between the duct of the ventral bud and oblique communication between the duct of ventral bud and duct of dorsal pancreatic bud, and opens here. It is called as duct of Wirsung. Opens in the second part of the duodenum by major duodenal papilla, and you'll also see the accessory pancreatic duct here, duct of Santorini, opens in the minor duodenal papilla. Major duodenal papilla is around 8 to 10 centimeter from the pylorus, whereas minor is around 2 centimeter above the major duodenal papilla. You can see there is also opening of common bile duct. So common bile duct and pancreatic duct, they form the hepatopancreatic ampulla here and open into the second part of the duodenum. By that, the liver is releasing the bile, pancreas is releasing the enzymes and fluid. You can notice there. That is how the sphincters are formed by the muscularis externa of the second part of the duodenum, sphincter of Oddi, surrounding both this common bile duct and pancreatic duct. Here, surrounding them, the sphincter is there. Sometimes these may open separately, and you can notice here the duct pattern. The duct begins from the pancreatic acini as the intercalary duct, then intralobar and interlobar, intralobular and interlobar duct, and the herringbone pattern, fishbone pattern. So there you can see here, coming to the relations of the tail, which is located here, compressed between the stomach, spleen, left colic flexure, and left kidney. So you already know the features of the spleen. It has three impressions: gastric, colic, and renal. So tail is related to the hilum. So the tail is related anteriorly and above to the stomach, forming a part of stomach bed, posteriorly and below to the left kidney, anteriorly and below to the left colic flexure. So just remember the where does hilum the spleen lies, the tail lies there only. You can notice here posteriorly and below it is related to the left kidney, and onto the left side is related to the spleen, anteriorly and above to the stomach. So that is about the different parts and the relations. You can just notice there the head is related behind it to the inferior vena cava and formation of portal vein. And as you go to the right side, here the body is related to the abdominal aorta and superior mesenteric vessel will take. You can notice there. So the posterior surface of the head related to the inferior vena cava, and portal vein is there, and you can see abdominal aorta and superior mesenteric vessel, whereas the splenic vein is related to the posterior surface of the body of the pancreas. And here also you can notice the right crus and left crus of diaphragm, and here you will notice the left kidney with suprarenal gland. That is the left kidney with suprarenal gland that you are noticing. So basically the pancreas is extending across the posterior abdominal wall, having relation with the different structures of the posterior abdominal wall, from the duodenum, second part of the duodenum, then inferior vena cava, in front of it portal vein, abdominal aorta, superior mesenteric vessels, right and left crus of diaphragm, then left kidney, and you can see there that is the uncinate process. Anteriorly it is related to the superior mesenteric vessels, posteriorly to the abdominal aorta. It is that part of the pancreas which is compressed between the superior mesenteric vessels and abdominal aorta, and above it is related to the left renal vessels and inferior mesenteric vein. Inferior mesenteric vein drains into the splenic vein. Splenic vein will be here, and this is the portal vein, superior mesenteric vein, and here will be inferior mesenteric vein and left renal vein draining into inferior vena cava. So you can notice that is the neck, the portion of the pancreas lying in front of the formation of the portal vein, neck of the pancreas. And coming to the duct here, if you open the some soft parts of the anterior surface of the head, here you can notice the duct of the pancreas formed by the herringbone pattern, like a fishbone pattern. It is formed by communication between the duct of ventral pancreatic bud and duct of dorsal pancreatic bud. They have oblique communication, duct of Wirsung, and here is the duct of Santorini opening into minor duodenal papilla. This is the duct of Wirsung opening into major duodenal papilla. Now coming to the arterial supply. So pancreas is basically formed by the two buds, ventral bud and dorsal pancreatic bud. Dorsal pancreatic bud is the part of the foregut. So if you see here, this much portion of the pancreas is derived from the dorsal pancreatic bud, whereas this much is derived from the ventral pancreatic bud. So lower part of the head and uncinate process are supplied by the inferior pancreaticoduodenal artery, which is the branch of superior mesenteric artery, which is the artery of midgut, whereas the upper part of the head, neck, body and tail are derived from the dorsal pancreatic bud, which is the derivative of foregut. That's why it is supplied by superior pancreaticodroidal artery, which is a branch of gastroduodenal artery, which is a branch of common hepatic artery, and it is a branch of celiac trunk. So the veins follow the blood vessels. There you can see the inferior pancreaticoduodenal vein drains into the superior mesenteric vein, and superior pancreaticoduodenal vein drains into the gastroduodenal and again into the portal vein. You can notice there. Coming to the lymphatic drainage, the head and neck part mainly drain to pancreaticoduodenal and pyloric lymph nodes, whereas the body is drained by the pancreaticosplenic lymph nodes, tail by the splenic lymph nodes. Ultimately, they drain into celiac nodes and superior mesenteric lymph nodes based on their blood supply. So remember, the blood supply indicates the composite development of the pancreas, and nerve supply is by the both sympathetic and parasympathetic. It is mainly an endocrine organ, but it also has exocrine portion supplied by the vagus. So if you isolate and try to see the blood vessels here, you can notice upper part of the head is derived from the foregut. That's why it is supplied by this superior pancreaticoduodenal artery, branch of gastroduodenal, which is a branch of common hepatic, which is a branch of celiac trunk, that is superior pancreaticoduodenal. You can see it is running along the concavity or the area between the C-shaped duodenum and the head of the pancreas. This is inferior pancreaticoduodenal, supplying the lower part of the head and uncinate process, branch of superior mesenteric artery, which is the artery of midgut. So upper part of the head is derived from the dorsal pancreatic bud, derived from foregut. Lower part of the head and uncinate process are derived from the ventral pancreatic bud, derived from junction between the foregut and midgut. And remaining part of the pancreas, that is neck, body and tail, are supplied by the splenic artery. It gives the pancreatic branches, and a larger pancreatic branch is called as Arteria pancreatica magna. And here you can notice the lymph nodes here, the pyloric lymph nodes, pancreaticoduodenal lymph nodes, superior mesenteric nodes, and here you can see pancreaticosplenic lymph nodes. These all drain pancreas, and depending upon their venous drainage, partly into superior mesenteric and celiac lymph nodes. Coming to the histology, as we have already discussed, it has an exocrine part which is serous in nature, and it has serous acini. You can see here, these are the small serous acini. Serous acini is small, having a small lumen, but it has a pyramidal cells. It has a small lumen, but cells are pyramidal. Remember all yes here. The small acini, small lumen, spherical nucleus and subcentral nucleus, that is the exocrine part, and endocrine part is represented by this islets of Langerhans, pale stained mass of cells among darkly stained serous acini. So here the exocrine and endocrine part is separate, and you can see when you stain with the Mallory-Hazan stain, the islets of Langerhans shows different cells like alpha cells, beta cells, delta cells, and some pancreatic polypeptide cells. Alpha cells secrete glucagon, beta cells secrete insulin, delta cells secrete somatostatin. And coming to the development, as the pancreas develop from two buds, that is the formation of buds. There is a ventral pancreatic bud and dorsal pancreatic bud. Dorsal pancreatic bud come from the dorsal side of the foregut, near junction between the foregut and midgut, whereas the ventral pancreatic bud come from the ventral side at the junction of foregut and midgut. So the ventral pancreatic bud is in relation with the hepatocystic bud there. This is a ventral bud, this is a dorsal bud coming from the foregut. This is a junction between the foregut and midgut. The ventral pancreatic bud come from this junction, whereas dorsal pancreatic bud come from the foregut. So during the development of duodenum, which we have discussed in the previous video, there will be axial rotation in the second part of the duodenum, resulting in the fusion of both ventral and dorsal pancreatic buds. And these buds, when they fuse, and there will be differentiation of the ducts under the influence of these genes ISL1, FGF10 and PVX1, and they result in the formation of the glands, which are derivatives of the epithelium exocrine part, and this fusion happens around 7 to 8 weeks. You can see there. If there is no axial rotation, the ventral pancreatic bud lies ventral to duodenum or to the right side of the duodenum, resulting in annular pancreas. You can notice here, this is the primitive gut tube, what you are seeing here. You can see here, this is the hepatocystic bud, what you are noticing. Here you can see there is a pancreas, and whatever above it is foregut, and you can see the midgut is undergoing a rotation there, resulting in the adult position. Before that, you should remember how the structures are located there, and you can see the development here now. You can see this is the ventral pancreatic bud, this is the dorsal pancreatic bud. Ventral pancreatic bud comes at the junction between foregut and midgut. Dorsal pancreatic bud come from foregut. So you can notice there, this is the hepatic and cystic bud. So ventral pancreatic bud is in close relation with the hepatic bud and cystic bud. That's why common bile duct and pancreatic duct have a common opening in the second part of duodenum in the form of hepatopancreatic ampulla. And due to axial rotation of the duodenum during its development, there will be fusion of ventral and dorsal pancreatic bud. Here will be the duct of dorsal pancreatic bud, duct of ventral pancreatic bud, and oblique communication forms between them and opens there. So again, if you see here, how does the pancreas develop? First, there will be formation of buds. This is the ventral pancreatic bud, dorsal pancreatic bud, formation of buds, and then there will be rotation. So from the dorsal pancreatic bud, you have upper part of the head, neck, body and tail. Here in this horizontal section, if you see here, this is the ventral pancreatic bud, dorsal pancreatic bud, duodenum, and this will rotate. Axial rotation due to axial rotation in the development of duodenum. So you can see there, rotation happens, ventral bud fuse with the dorsal bud. From the ventral pancreatic bud, what we have? Lower part of the head and uncinate process. That's why it is supplied by the inferior pancreaticodroidal artery. From the dorsal pancreatic bud, we have the upper part of the head, neck, body and tail. That's why it is supplied by the superior pancreaticodroidal artery and splenic artery. And the main pancreatic duct is formed between the oblique communication between the ventral bud and dorsal bud. And along with the duodenum, the pancreas, which is peritoneal, it also moves to the right side, and by zygosis it becomes retroperitoneal. You can notice here, by zygosis it becomes retroperitoneal. So remember, the process by which the abdominal organs become retroperitoneal is called as zygosis. Thank you very much.